Why a coronavirus vaccine may not end the pandemic. As pharmaceutical giants race to develop treatments for the novel coronavirus, fears abound that even the development of the right vaccines or drugs may not signal the end of the pandemic. Countries worldwide have been expressing concern about which nations would get the vaccines first. Despite companies like Johnson & Johnson ramping up efforts to produce billions of doses of a potential vaccine, experts believe it may take years for enough of the vaccine to be made for the entire world. According to the Washington Post, around 5.6 billion people, or 70% of the world's population, would need to be vaccinated for herd immunity to work. The problem is that poor countries may not be able to afford the vaccine, and manufacturers may end up selling their products only to the highest bidders or the richest countries. Countries where the manufacturers are located may also start stockpiling vaccines for locals and not leave any for other nations. In 2009, rich countries like the US were at the forefront of vaccine development for the H1N1 influenza virus, while poor countries struggled with supply until the pandemic ended. The Centers for Disease Control and Prevention said that over 80 million Americans were vaccinated during the swine flu pandemic, around the same amount of doses received in 77 countries worldwide. Gavin Yamey, director of the Center for Policy Impact in Global Health at Duke University, said, "Unless we make this vaccine globally available, we are not going to be able to end the pandemic because an outbreak anywhere is an outbreak everywhere." The US has already begun adopting an America First mentality, with Biomedical Advanced Research and Development Authority Acting Director Gary Disbrow saying, "Right now, we're focused on the whole of America approach required to expedite availability of vaccines." Disbrow's office has already invested millions of dollars in Johnson & Johnson, Moderna, and Sanofi for vaccine development. Moderna is a Massachusetts-based company working with a Swiss company, and Sanofi is a French drug company. Competition over vaccines may mimic the competition seen across the world over medical supplies and equipment. In March, the World Health Organization issued a statement warning that the disruption to the global supply of personal protective equipment was putting healthcare workers and patients' lives at risk.